Good evening. My name's Rachel. I'm going to be your nurse tonight, okay?
Hi, Rachel.
How are you feeling?
I don't feel too good.
You don't feel too good. What's going on?
A really bad headache. Like bothering my eyes.
It is? Okay. On a scale of 1 to 10, 10 being the worst,
An 8.
it's an 8. Okay, I'll see if I can get you something for that as soon as I'm done, okay? You look a little off tonight. Is your face sore or anything?
No.
No? Looks like it's a little droopy, like. No? Can you smile for me? Big smile? That's it? Okay, I'm gonna do it. Okay. Can you squeeze my hands as tight as you can? Tight. Okay. Now I'm gonna hold your arms out straight and I want you to hold them up. Okay? That's it? Okay. Let me test your feet here. Alright, now push against my feet as hard as you can, like a gas pedal. Okay.
Oops, my right leg.
Okay.
I'm in trouble.
I'm just going to take a quick listen to your heart. Alright, your heart doesn't sound too bad. I'm going to take a quick blood pressure, okay? Blood pressure is quite high. Alright, let me do one more thing here. I'm going to take a quick look at your pupils, okay? Alright, do you have any other symptoms right now that you can describe to me? Just the headache, your right side feels very weak, your blood pressure is high.
I tried to drink some water before and I had trouble swallowing.
Okay.
Starting to choke.
Choke, okay. Alright, well, what I'm going to do is I'm going to call a stroke alert, okay? You don't need to be scared. You're in a good place for this to happen, okay? But I'm very concerned and we want to get you some help, okay? So just bear with me for a second. I'm going to press our emergency button to get some help, okay?
Are you okay?
You will.
I'm nervous.
It's okay. Just take some
Can I help
deep
you?
breaths. Hi, Rebecca. It's Rachel. Can you please call a stroke alert stat for room 12?
Absolutely.
Thank you. Okay. All right, so the patient that I just assessed, she came in yesterday here to the ICU. She's a 55-year-old female and she came in for hypertension. So we admitted her up here so we could monitor her vital signs, make sure she was stable. As I did her assessment tonight, I noticed that she was showing signs and symptoms of a stroke. Her first main symptom was a severe headache. Her blood pressure was still high. She had right-sided weakness, and she also complained of difficulty swallowing. So immediately I did an assessment. She was very weak on her right side, and I called a stroke alert so that we could monitor her. Some of the main warning signs of a stroke is basically just numbness and weakness, confusion, trouble speaking, also slurred speech, difficulty speaking, the severe headache, hypertension, seizures. Those are the main warning signs of a stroke. And you're going to want to get help right away if you or someone in your family has any of those signs right away. The human brain is composed of 3 different sections. There's the cerebrum, the cerebellum, and the brainstem. The cerebrum is the largest and most developmentally advanced section of the brain, and it consists of 4 main lobes, which is the frontal lobe, the parietal, the occipital, and the temporal lobe. And the cerebrum controls higher functions such as speech and emotions. And it's also divided into left and right hemispheres. The cerebrum, which is this little lime green area that I've drawn here, That's the second largest area of the brain, and it controls like reflexes, balance, movement, and coordination. And the brainstem we have here is mostly responsible for automatic functions that are very critical to life, and if a stroke occurs in the brainstem, it's usually life-threatening. And it controls things such as like breathing, digestion, heartbeat, and as well as like alertness, the state of being awake. Now, a stroke can occur anywhere outside of the brain. You can get a blood clot anywhere in your body that can travel to the brain. And the symptoms that a patient experiences are directly related to which section of the brain is affected. So for example, like the cerebrum, the largest section of the brain, if a stroke occurs in the right hemisphere of the cerebrum, the patient's going to show signs and symptoms of left-sided weakness. That would be the right side of the brain. And vice versa, if they have a stroke in the left side of the brain, they're going to have paralysis on the right side of their body. So that's interesting to know. In the cerebellum, someone that has a stroke and the cerebellum is affected, that's going to be the symptoms like the lack of coordination and clumsiness, balance problems, mostly things that interfere with a person's ability to walk, talk, eat, and perform any like self-care tasks. And then like I mentioned before, the brainstem is the most devastating, life-threatening, because it interrupts the involuntary functions that are very essential for life. People that do survive a stroke in the brainstem are usually end up as a vegetable or have severe impairments for the rest of their life. There are two main types of stroke. The first is an ischemic stroke. This accounts for about 80% of all strokes in the United States. An ischemic stroke is an inadequate blood flow to the brain from either a partial or a complete occlusion of an artery. It's essentially a blood clot in a blood vessel. The second type is a hemorrhagic stroke. This accounts for about 15 to 20% of all strokes. It's caused by the breakout of a blood vessel in the brain. It's a much more serious type of stroke and has a poor prognosis. Now, how to prevent a stroke? There's really no way to prevent a stroke. However, there's things that people can do in their daily lives that can help reduce their risk. One is to maintain a good body weight, have good physical exercise, don't drink, don't smoke, maintain a normal blood pressure, and reducing salt and sodium intake can also help. The risks are basically just the opposite of how to prevent a stroke, which if you're overweight, you have a family history, hypertension, if you smoke a lot, drink a lot, have a poor diet, and age has a big factor to do with it. So basically, in conclusion, a stroke is one of the leading causes of long-term disability in the United States. A stroke is an immediate concern, and a person should be brought to the hospital right away if displaying any signs or symptoms. A stroke can occur at any moment and should be taken seriously, so if you're having a stroke or see someone having a stroke, call 911 right away.